Good evening and welcome to another edition of the Yuba City Medical Explorer. My name is Dr. Robert Peppercorn and my specialty is dermatology. I serve as host of this program. The purpose of the Medical Explorer is to explore the medical communities of Yuba and Sutter counties and to take you behind the scenes of medical care practices right here in our local area. We have a very interesting program for you tonight as we explore a new X-ray technique that allows doctors to locate diseases in the body without pain or surgery faster than any technique previously known in medicine. We will explore the CAT scanner, CAT scanner, located at Rideout Hospital. The Medical Explorer will also introduce you tonight to one of our area's most highly skilled physicians who specializes in neurology, internal medicine, and endocrinology. We will discuss some of the new breakthroughs in these fields that are truly improving the qualities of our lives. Our program should be very interesting and quite informative tonight, and I hope that you'll stay with us for the next half hour. Before getting to our topic tonight, let's take a look at the latest medical news. Drinking strong coffee can help asthma sufferers caught without their usual medicine, a new study indicates. The study confirms an observation made 125 years ago by a British doctor, but not tested until now. Caffeine opens bronchial passages, allowing asthma sufferers to breathe during an attack. Researchers at a Canadian university reported in a recent New England Journal of Medicine that caffeine was as effective in improving breathing capacity as its chemical cousin called theophylline, now the most common asthma medicine. But researchers say caffeine should not replace theophylline or other asthma medications for routine use. There's no reason to change from good medications to caffeine, the researchers reported. An estimated 7 million Americans have asthma, including 2 to 3 million children. The study compared 13 children who took caffeine with 10 who took theophylline. Both groups had mild side effects, shakiness, dizziness, or tremors, but did quite well. My next medical news story concerns heart surgery. For 1 in 5 people with early signs of heart disease, costly bypass surgery is no more effective than drugs in easing chest pain and preventing heart attack or death, a new study shows. The study, also reported in a recent New England Journal of Medicine, is the most comprehensive on the increasingly popular surgery and the clearest yet to show that bypass surgery, which can cost up to $25,000, may be done too often or too soon after symptoms develop. About 200,000 people will have a bypass operation in this country in 1984. The study suggests that up to 40,000 could be treated just as effectively with drugs alone. The researchers compared 390 people who underwent bypass surgery with 390 who were given drug treatment. After an average of 6 years, 83% of those who had surgery and 82% of those who took the drugs were alive. 16% of the surgery group and 12% of the drug group suffered heart attacks. The researchers say the study doesn't apply to the 80% of people whose arteries are so clogged with fat deposits that coronary bypass surgery can't be avoided. My final medical news story concerns the medical uses of marijuana. Glaucoma sufferers and cancer victims may soon get some relief if the federal government approves a new marijuana pill containing the active ingredient in marijuana. The pill helps relieve the nausea that accompanies chemotherapy and eases eye pressure in glaucoma patients. A report in a recent issue of Medical World News says a capsule containing synthetic tetrahydrocannabinol, or THC, is wending its way toward FDA approval. A bill has also been introduced in Congress to legalize marketing of marijuana cigarettes for both these medical purposes, according to the report. Now, on with the Medical Explorer. Early in the 1970s, British scientists developed a new X-ray device that has totally revolutionized the field of diagnostic radiology during the past 10 years. This new X-ray device is called a CAT scanner, which utilizes computers to improve the qualities of X-ray pictures. We, the residents of Yuba, Sutter area, are quite fortunate to have one of these very expensive scanners available at Rideout Hospital in Marysville. Our community is also lucky to have extremely well-qualified radiologists available who understand the proper use of this fantastic medical tool. Let's meet one of these radiologists and learn more about the CAT scanner at Rideout Hospital. I'm standing now in the special area of Rideout Hospital, which is designated for the use of the CAT scanner, CAT scanner. We'll talk a little more about what that is, but let me introduce my guest today, Dr. Bob Wallace, a radiologist with Bi-County Radiology. Dr. Wallace, thank you for being with us today.
Yes, my pleasure.
I'd like you just to tell our viewers a little bit about what a radiologist is to begin.
Radiologist is an MD that has had specialized training in X-ray and facilitating the diagnosis and treatment of patients, helping the other MDs with this particular modality. It means that we see patients that may have ulcers and do special GI series, and also the common things such as a chest X-ray to try to rule out tuberculosis and those things.
Sure. How many years after medical school does it take to become a radiologist?
About 5 years, a year of internship, and then 4 years of specialty training.
That's quite a few years of training.
Yes, that's a long time.
You just don't, people just can't go out there and hang up a shingle and start using these machines and do it.
No, it takes, you have to be in training for some time.
Right. Now, we should emphasize that a radiologist is not the same thing as a radiation therapist, which we've seen on one of our previous programs.
Correct. Many years ago, and I'm old enough to know, this was all one specialty. And for some years now, some 15 years, these have been broken off, and the therapy portion is a separate thing, so that these 4 years I spoke of is devoted entirely to radiation therapy training, and the rest would be, the other people would be in diagnosis.
So you're a diagnostic radiologist?
Yes.
Right, I see.
Correct.
Now, let's switch more to our topic now, which is the CAT scanner. We're in a room now that is filled with equipment. We can look, and we will look over there at the computer that controls this machine, and here we have some, looks like television monitors. Tell us what is meant by computerized axial tomography, CAT scanner. What does that mean?
I think probably the simplest way to put it would be that it is X-ray that is placed through a computer so that it can bring up a special X-ray image showing things that we never before could see. It's said it's about 10 times as sensitive as a normal X-ray.
So the computer is actually able to make it clearer for you to visualize things?
Correct. Correct. Also, it can, where you would take a chest X-ray through the body with the computer, once you get the image in the computer, then you can have all different directions of visualization by simply playing with the computer.
Now, I understand that this machine has really performed miracles in terms of looking at the brain, which really couldn't be done well with before.
Yeah, that's where it was first used, and that's still where it is really very valuable, because now, for instance, in this community, just a few years ago, if someone came in with a head injury, if it was very serious, they would be shipped to a center. And we have the CAT scanner, and we can do a CAT scan of the brain and tell if they have any hemorrhage, if it's normal.
How long has the CAT scanner been here at Rideout?
Nearly 3 years now. It was 3 years soon in April it was started.
What do these machines cost nowadays for a new one?
Well, the modern versions are up close to $1 million, $800,000 to $1 million.
Dr. Wallace, whenever I see a computer keyboard and buttons, I'm always ready to go and start pushing them. I love gadgets. Can you show us how this CAT scanner actually works?
Yes. I think better, though, I'll introduce you to the X-ray technologist who actually does run this machine, Mr. Eamon Ferry.
Mr. Ferry, would you show us how the machine works?
Sure, I'd be glad to. On your keyboard, you have your main cursor switch, which you can manipulate all these different dials or buttons to be able to see different things for the radiologist in his interpretation of the film. As like I'm doing now, you can see the cursor which moves around. He can check the density of the tissue and the bone and up here the air, which will give you different readings down here and tell the doctor whether it's fluid something hard or soft, whether it's blood, and that way he can differentiate the different areas.
So there's really, the guessing is really removed here. You really can tell exactly what you're looking at.
Right. The doctor can actually know if he's looking at a different area, if there's fluid in it, or if it's edema, or tell if it's blood by the density reading, and helps him to diagnose a correct, film.
Show us what you can do by moving the pictures around or something. Can you do different things like that?
Sure. There's many different things you can do. Is here, I can show that this darker area here is lighter, and the doctor can see that this patient has some edema in there, and the number is, down from normal. And normal would be over in this area over here around 37. So he sees that there's a difference between 37 and 18. He knows that this is a trouble area.
Tell us exactly what you're looking at there, though. What is that?
This is a slice of a patient about midway through the brain, and this is your frontal sinus area up here.
So those black areas are air spaces in the sinuses?
Yes, they are air spaces. And this is your brain, this area here, and the white area is the bone. It shows up white because it is harder. And the little spots you see here are like calcium, which are calcified, actually bone.
Well, when that picture comes on the screen, how fast does it actually come on? Can you show us that?
Yes, sure. Like I hit next page, we'll bring the next slice up in this patient's file.
So we're looking deeper into the brain here.
Right. We work from the bottom of your skull, or the patient's brain, upward towards the top. So we're moving upward into the patient's anatomy.
What I'd like to do now is actually have you show us how a patient is placed on this machine, so when they have the CAT scan done, we can see what they go through.
I'll just roughly go through what each patient does for a brain, and what we do is how we lay them down and put them in there so that everybody can see what actually a patient does go through.
Great, just tell me what to do.
Okay, first need you to just step back a bit and take your coat off.
Okay. Now, ordinarily patients don't have microphones in their hands, but for this I will.
And first of all, I have you sit just right here facing towards me.
Okay.
Now, in each patient, we put a stockinette so that it holds their hair in tight and doesn't cause artifacts. Okay, and keeps a clear field for the doctor's reading. This will be tight on your head and holds your hair in for us. Okay, then we have you lay down on your back, your feet down this way. Okay, what I'd like to point out is that when we do tape a patient in, they are taped there mainly for a reminder and holding still. But if a patient were to get scared or something to happen, they can jerk their head up and out of the gantry or the tape without any problem. Okay, have you sit up now.
Alrighty.
Okay.
Well, let me ask you just one more question, and I'll take this little stocking cap off.
We even have patients ask to keep that.
Do they?
Yeah.
After the CAT scan is done, the results are evaluated by the radiologist.
Yes.
Is the patient told the results?
The report is sent to the patient's physician.
So the doctor that ordered the test would find out what was going on,
Right.
and the patient would then ask the doctor what happened.
They wait for their next appointment with the doctor, or if the doctor wants to phone them to let them know, he will call them. Or if he wants a wet reading, our doctor will call him immediately after the study.
And when a patient needs a CAT scan procedure, they can't just come here and ask for it, can they?
No, there are certain requirements for having the study done, and part of this reason is that not just because you have a headache you can have a CAT scan done. They have you have to have medical reasons for having one done, and a large part of that is the high cost of a scan.
Well, I probably should ask you what a scan costs.
A scan can cost anywhere between $300 to $600, depending on the amount of the study the doctor wants done.
Well, for the amount of information that's gained, that really isn't a tremendous price when you think that past years, before 10 years ago, people had to have invasive procedures done to look in the brain.
Oh, true. It is an expensive study, but it's a very informative study.
Again, I'd like to thank the Bi-County Radiology Group and the staff of the X-ray department at Rideout for allowing the Medical Explorer to travel behind the scenes of their CAT scanner department. I'd like now to introduce you to a Yuba City physician who's also an expert in the use of the CAT scanner. He's Dr. Jahangir Mahmoudi. Dr. Mahmoudi is a specialist in the fields of neurology, endocrinology, and internal medicine. Dr. Mahmoudi, thank you very much for letting the Medical Explorer come to your office tonight. Let's begin by having you tell us a little bit about your postgraduate education and training.
Yes, I'll be happy to. I am a graduate of several well-known teaching hospitals in this country. I started first in 1970, was a resident at Washington Medical Center.
Where is that?
In Washington, D.C.
Oh, in D.C.
Well, yeah, was a program affiliated to Georgetown University. I had 2 years of training in internal medicine there. And then I went to fellowship in diabetes in Boston, New England Deaconess Hospital, Joslin Clinic, which is an affiliated hospital to
Harvard
Medical School. I spent a year there. And then I went to Texas, Houston, Texas, the University of Texas, MD Anderson Hospital.
That's a major cancer facility too, isn't it, down there?
That's right. And I spent a year and a half fellowship in endocrinology there.
So you have training. We still have more after that, don't you?
Right.
Go ahead. I don't want to interrupt you. What else after that?
Then after that, I was very interested in the area of neuroendocrinology, which deals with the pituitary gland, the hypothalamus, the brain peptides. So I came to California, and this was in 1976, and attended the University of Southern California and the Kaiser program.
So you have training in internal medicine, diabetes, extra training,
yes,
endocrinology, which is glands and hormone disorders,
right,
neurology.
and the neurology. The University of Southern California was the neurology.
So you have 3 major medical specialties in your background. There is no one else in this community that has this number of backgrounds of training, I don't think. Isn't that true?
Yeah, I think so.
You're too modest. It's fantastic. I'd like to get into the specifics of what a neurologist does. Now, a lot of patients go to their general physicians and they have those problems taken care of, but people don't really understand what neurology means. What is neurology?
Well, it's a diseases of the nervous system, like problems with brain. The most common patients that goes to the neurologist are people with varieties of headaches, then dizziness, complaints of dizziness.
So not just the brain, though, there are other parts as well.
Right, the head.
But the nerves go into the other parts of the body, too.
That's correct.
So you're dealing with any part of the nervous system, from the brain to the fingertips or the toes.
Right, involves the brain, brain stem, and the cerebellum, that deals with the coordination.
Right.
There is a lot of degenerative diseases of the nervous system, multiple sclerosis, Parkinson's disease.
Right, we'll get into that in a bit, too. I'm curious, we just spent time at the CAT scanner at Rideout, and we showed our viewers how that works. Right. And I would like to know, when do you order a CAT scan for your patients? What would be a reason for getting a CAT scan?
Right. When I have a patient who complaining of unusual headache and is not responding to medication, and there might be sometimes a focal neurological findings, meaning there are some findings on the neuroexamination, absolutely a CT scan.
And when a patient comes into your office with one of these complaints, you don't immediately ask for a CAT scan. You do a thorough examination.
Yes, right. First,
what goes on with that exam? What happens?
And that examination, of course, like other field of medicine, taking the history, then we spend more time in checking the cranial nerves. There are 12 cranial nerves.
The nerves that supply the face and the eyes.
Supplies the face, the eyes, yes, sense of smell, taste, vision, hearing, and swallowing, all these reflexes. then the strength of the extremities, the motor power, and then the reflexes, coordination, and
when I was in medical school and I had to do these examinations, the neurology, the neuro exam, would always be the last thing we would do, and we'd always brush through it. But to do a good neurological examination can take an hour sometimes, can't it? Really, it can take quite a while.
That's correct.
On a previous program on the Medical Explorer, we examined the Alzheimer's disease support group in town. Tell our viewers a little bit more about what Alzheimer's is, especially for those people that didn't see that program. Right. What is Alzheimer's?
Before saying what Alzheimer's disease is, I think one has to define what dementia is,
Great.
or impairment of memory, to be simple. And the Alzheimer's disease is one of the most common causes of dementia. So what the dementia is deterioration of mental function from a previous level. And so then there are 50 different causes of dementia. And 50% of these causes of dementia, the 50% of those are Alzheimer's disease.
So what might a family of a patient with Alzheimer's notice about that patient? What would be a symptom of Alzheimer's disease?
Initially, these patients, the findings are very subtle, and the patient himself or the other members of the family, they are not aware of it, and it goes for several months unnoticed. But most of the time, the patients that they come in a family, they notice inappropriate behavior and lapse of memories, inability to respond to environment accurately and quickly. And then the memory impairment comes and it progresses with disorientation, confusion.
And it can be quite frustrating for the family members to see this.
That's right. And often these patients, initially, they know that they have mental deficiency. They're unable to cope with the environment quickly and accurately. They get depressed.
Does anyone have a cure for this problem?
Well, there has been many research, and so far there is no treatment.
No one knows what causes it.
No one knows exactly what causes the disease. So there is really no treatment. But there are medications that the neurologist or other practitioners, they can use to control the symptoms.
Right. Now, that's what you could do if people came to you to discuss that, to help with the symptoms of depression and other aspects of the disease.
Yes.
Another devastating disease that many of us are faced with is the disease of stroke.
Right.
What is really meant by the word stroke?
A stroke is a vascular insult to the brain. And
now, we should probably simplify those words a little bit. You mean blood vessel is being blocked in the brain, like a pipe that has a tennis ball in it. The flow can't get through that.
That's correct. That's right. The blood vessels are closed by a clot, and the clot could migrate it from the other part of the body, or most commonly in the neck.
So a clot might start in the neck area and move up.
Then move up, go to the brain, and closes one of the arteries. And that portion of the brain become ischemic or dies, and that would cause the neurological deficit.
Do people always die from strokes?
It depends where the stroke is. If the stroke involves the brain stem, where the vital is a vital center of the nervous system, like respiratory center or cardiac center, then patient goes into coma and dies from respiratory arrest or cardiac irregularity.
But at the same time, the part of the brain that affects the movement of a hand might be affected.
Right.
And not stop the heart from beating.
That's right. Most of the time, the patients that we see in the hospital have a hemispheric stroke, is in one side of the brain, and they come with a left-sided or right-sided weakness.
What can be done for those patients?
If the stroke is completed, there is really not much can be done as far as curing. The main goal of treatment is the rehabilitation and physical therapy. If the stroke is progressing and is not completed, then anticoagulation and giving certain medications, blood thinners, that to prevent the further progression of the stroke. And so
it's been amazing to see some famous movie actors or TV actors that we've seen before were in perfect health. All of a sudden they get a stroke and they cannot do anything. And then 5 years later, after physical therapy, occupational therapy, they look very good.
Yes, that's correct, right. Physical therapy, speech therapy, occupational therapy are very important in these patients, and as you said, it takes time. You know, for a few years they could reach 80% of their functional capacity.
Years ago, we didn't have that good therapy for these people, so it's quite a breakthrough, I think.
That's true.
Is there anything that can be done to prevent a stroke? Do we know what causes a stroke?
Like a heart disease, again, there are some risk factors. Basically, the stroke, the risk factors of the heart disease are same for the stroke.
What are some of those?
Are hypertension,
high blood pressure,
diabetes, obesity, smoking, inactivity, and then the genetic factor.
Oh,
the
heredity. Runs in the family or not?
Runs in the families. So.
So by keeping blood pressure down, by controlling diabetes, by quitting smoking, by losing weight, by exercising, people may have less of a chance of getting a stroke. Now that's one thing we can work on preventing and maybe keep people living longer.
Yes.
I'd like to invite you to write to me at my dermatology office in Yuba City with your suggestions for areas and people that you'd like to see on this program. As you know, the Medical Explorer is a public service educational program, and I really do want to hear from you with your comments and suggestions. Please write to me at 367 Del Norte Avenue, number 4, in Yuba City. In my next program, the Medical Explorer will take you behind the scenes of more interesting frontiers in the medical care practices of Yuba City and Marysville. Till next time, I'm Dr. Robert Peppercorn, your Medical Explorer. Thank you for joining us tonight, and have a good evening.